Nisha here. Today I am going to discuss about the topic vaginitis. What is vaginitis? Vaginitis is inflammation of the vagina caused by infection, irritation or imbalance of vaginal flora. There are three most common types of vaginitis. First will be bacterial vaginosis. Second will be candidiasis. Third will be trichomoniasis. Next, we are going to discuss about signs and symptoms of vaginitis. First sign will be abnormal vaginal discharge. From that we can see various color of discharge, smell and also consistency of texture, followed by vaginal itching, irritation or sometimes soreness. Next will be burning sensation, especially during urination. Then there will be redness or swelling of vulva. After that there will be feel pain during sexual intercourse. Finally, there will be some kind of fishy odor. Normally this odor will be on bacterial vaginosis. Next will be patient history taking process. During process, as a pharmacist, we need to ask patient few questions based on the vaginitis. First will be how long the duration of symptoms. Second will be can ask the patient the discharge color, smell and amount. Followed by we can ask them about the presence of itching, pain, burning, sensation or bleeding presence. Then we need to know whether the patient is on antibiotic course or not. After that we need to ask about the sexual history, whether they are on new partner, they are using any condoms or they having any STI exposure. Then need to check with them whether any previous episodes of same issue of vaginitis, and then can ask about what type of feminine hygiene products they are using. For example, if there is any scented products, douching and menstrual products. Finally, but most importantly, we need to ask about the patient's pregnancy status. Now we are going to discuss about the differential diagnosis process for those three types of vaginitis based on the patient history. Firstly, bacterial vaginosis, the texture will be thin, off-white discharge with fishy odor and without any inflammation. Secondly, trichomoniasis, the texture will be thin but yellow-green color and also malodorous with frothy discharge. There will be vaginal inflammation. Thirdly, Candida vaginitis, the texture will be thick with cottage cheese discharge. There will be vaginal inflammation. Apart from those diagnoses, there will be some other possible conditions which patient usually mistakenly thinks that it is vaginitis, sometimes not. First will be UTI, vulvar dermatitis, which is due to irritants or allergies. Then will be atrophic vaginitis. This is due to the postmenopausal dryness and irritation, followed by STI, which leads to discharge and pelvic pain. Finally, foreign bodies, which makes persistent smelly discharge. We are going to discuss about the treatment overview, which including OTC options and some other medications require prescriptions. For candidiasis, OTC option will be clotrimazole cream or pessary. Oral antibiotic will be fluconazole, which require prescription. For bacterial candidiasis, prescription options will be metronidazole antibiotic tablet, while OTC option will be clindamycin cream. For trichomoniasis, oral antibiotic will be metronidazole tablet, while OTC option will be fluomycin vaginal tablet. When we should refer the patient to doctor? If they having persistent symptoms, severe pelvic pain, recurrent episodes of vaginal issue which is more than 3 times within the year, pregnant patient with symptoms, suspected STI problem, example pain, discharge, bleeding, symptoms that do not resolve even after OTC treatment, abnormal bleeding or blood stain discharge. Finally, immunocompromised patient because most of the medicine not suitable for them. Next, what are the patient care plan? We must educate the patient on correct medication use. Ask them the full course of treatment. Can advise them to avoid dodging, scented pads, soaps or sprays. Maybe can ask them to use mild or soap-free feminine wash externally. Advise them on inner garments. Can wear cotton underwear, will be more comfortable and can prevent risk of irritation and also can feel more breathable for the whole day. Can advise them on practice safe sex. Example, can ask them use condoms during encounter their problem, this kind of problems. Finally, can ask the patient to follow up with us if the symptoms persist. As a conclusion, vaginitis is common and usually treatable. Symptoms can look similar, so proper assessment is important. Treat based on the correct cause and avoid self-misdiagnosis. Refer the patient when symptoms are severe, recurrent or unclear. Good hygiene and education help prevent future episodes. These are my references and thank you.